Hi, this is Rate 301, and in this lecture we're going to cover the biliary system and the liver. So we're going to start with the biliary system, and we're going to take a good look at the gallbladder here. We've got three images, the diagram here on the left, and the ERCP in the middle, and MRCP on the right. And so we're going to take a look at the gallbladder first, and it's in green here. This is the fundus of the gallbladder. It is the most inferior portion. And as you go superior on the gallbladder, you get to the body and then to the neck, and that joins into the cystic duct here. And then at the top, we have got the right and the left hepatic ducts. And those join together to become the common hepatic duct. And then the common hepatic duct and the cystic duct join up for the common bile duct. And that runs about 8 centimeters in length. It goes down near the head of the pancreas, the head and the neck of the pancreas, and then joins up with a third loop of the duodenum. And we'll go over that in more detail as we get to some of the Netter's images. And here we have a good look at that through the ERCP. We've got the gallbladder here and the cystic duct. So this image is very similar to the one on the left, although the gallbladder and the cystic duct aren't quite as straight on this image. You can see the right hepatic duct, but you don't see the left one very well. And then the common hepatic duct here. And then that joins up to the bile duct, the common bile duct. And you can see the ampulla of Vater and then duodenum. So you can see the contrast has actually gotten there to the duodenum. And then here on the MRCP, you don't actually need any contrast here. It is picking up the signal from any fluids. So you actually get to see the duct of Wirsong here, which is kind of neat. And then you see the gallbladder here and the cystic duct, which looks like it might be a little tortuous or might even have some stones. These darker areas here may be stones. You might even see some darker areas here in the gallbladder itself. And then this image B here is showing some possible stones near the ampulla of Vater, and you see some contrast that's gotten into the duodenum. So that are some images of the gallbladder. And now looking at the gallbladder on CT images. So you can see here that this little portion right here is a gallbladder. And anything that has fluid in it is going to be sort of like a dark gray color. So you can see some fluid in this. And also looks like there might be a cyst on the kidney there. So that's kind of a dark gray. And once again, you can see the pylorus here. That's the part of the stomach. And you can see the air in the pylorus. And there's the head of the pancreas here. And you can see how the common bile duct looks like it's going right through the head and the neck area of the pancreas. And you've got the SMV, superior mesenteric vein, and the SMA, superior mesenteric artery. And we know this is a CT scan because bone is white, so you can see the ribs here. And you can see the vertebral body, which this might be getting into the disc area, so that's why you don't see it bright white. And then there's the spinous process here in the back. And this is air in the fundus, and there might be some air anywhere where you see black. That usually means air, so that's probably gas. Then over here, there's a little better image of a gallbladder. This person's gallbladder looks like it's a little bit more horizontal in the body instead of being more vertical in the body, so you get a really good image of it there. And it's positioned in the inferior aspect of the liver along the right edge of the quadrate lobe, and we will see that when we get into the liver again. The liver and the gallbladder run at about a 45-degree angle, so usually you don't catch it quite as nicely as this, but you'll see why when we get to the images of the liver. So here's a nice image of the gallbladder and of the portal triad. And this actually, the gallbladder has been lifted up, so it doesn't look like it hangs inferiorly like it normally does, and that's because they've lifted it up so that you can see the vessels a little bit better. So this is actually the fundus of the gallbladder now, and then the body, and then the neck going into the cystic duct. And then you've got the hepatic duct here, and there's the right and the left hepatic duct. And you've got the hepatic artery and the portal vein. And these three make up the portal triad. You can see here the portal vein right there in blue, and the common hepatic duct or the common bile duct in green, and then the common hepatic artery in red. And it's called the portal triad here. There are several more instances of it in the liver itself. There are many places, because the liver is segmented, this portal triad exists in all the segments of the liver, and that is why it can actually be resected fairly easily. And when there are problems within the liver, either cancers or tumors or other things that are wrong, they can actually resect part of the liver fairly easily because it gets fed with these three vessels all the way throughout the liver, and we'll see that a little bit later too. So the common bile duct runs behind the head of the pancreas, and then it goes into the duodenum. And here are just a few more images of the gallbladder. Once again, you've got the fundus here and the body and the neck going up toward the cystic duct. Here's a great image or a great drawing of the liver. So you can see that the liver sort of runs at a 45-degree angle here, and then so does the gallbladder. It sits right along that edge of the liver. And the fundus, body, and neck again going into the cystic duct, the common hepatic duct coming down here. And it will drop in, the bile duct will drop into the duodenum. And one more time over here. You've got the gallbladder, the neck of the gallbladder, common bile duct. This is actually a view from the left. So that's why the cystic duct kind of looks like it sits off to the left-hand side here of the bile duct, but it's just because the patient is rotated. So you're viewing it from their left side. And then there's a duodenum down here. So this is the liver here, and the liver is the largest organ of the abdomen. It is actually the largest organ of the body, second only to the skin. The skin is the largest organ of the body. And so here we have anterior and posterior views. So on the anterior view here, and the liver is going to get a little bit confusing, so just hang in there. The liver is divided into right and left anatomical lobes. Anatomical lobes. So the right and the left lobe are divided by the falciform ligament. You can see that here, and you can see, I think, a little bit of the falciform ligament. You can't really see it, but it divides it up through here. And then you see the fissure for the teres ligament, and then the round ligament. And the round ligament is just a cord-like structure that hangs off the bottom here. It's an extension of the teres ligament. And so you have, once again, the left and the right anatomical lobes. If you were to flip this over to the posterior view, here you can see the back. This is the right lobe here. And you can see how far it extends down. Sometimes this extends down quite far in patients, and you have to be aware of that when you're scanning in CT or MR, that you get all the way through the liver. Even if you think you have by going to the bony pelvis, some people will have parts of their liver go down below the bony pelvis. So the liver is covered at the top by the diaphragm, and the diaphragm extends in the back a little bit and in the front and along the sides. But here in the back and underneath, there is some bare area where it connects with the viscera, and so it's the visceral surface. We're going to see that a little bit better when we flip it up and look at the underneath side. So we've got the IVC here and the portal vein here, and in between those two is a caudate process. And the caudate process is actually a medial extension of the right lobe of the liver. We have the caudate process here, or sometimes they call it the caudate lobe. And then we have the quadrate lobe here, and that's an extension, a medial extension off the left lobe of the liver. So once again, from the front side, we've got the right lobe and the left lobe. We've got the gallbladder here and the IVC here. Oops, sorry, I didn't mean to draw on that. And then over here we have the IVC again from the posterior side. This is where the hepatic veins come in, these three little circles here. And we have the gallbladder here on this side. And it runs down along the 45-degree angle, the same as the liver. So when you're thinking about this in cross-section, you're often going to catch only pieces of the gallbladder or pieces of anatomy. If you think of drawing a thin line across here, and what structures you would get if you just drew like a thin line, like maybe as thick as this line right here, and what structures you would catch. And then if you made a slightly thicker line, like maybe from here down to where the word portal is, and you go all the way across, and you think you might catch a few more structures there. So each image in a CT scan will show you varying degrees of anatomy depending on how thick the slice is. So we're going to go on to the next picture of the liver. So this is the liver, and this is the Netter's plate. And I put, usually on the slide, I will put the Netter's plate number here so that you can have it as a quick reference when you go on Bellevue College's library database and check for the Netter's book there. I've used the 5th edition because most of my images were pulled from the 5th edition, and then they added the 6th one shortly after that. So most of mine will be from the 5th, and they may be quite similar, but if you're looking for these specific images, I would check the 5th edition first. So this is an anterior view of the liver. This is the right lobe of the liver here, and there's the gallbladder, and the left lobe of the liver. And these are, again, the anatomical lobes. And this is a falciform ligament. And you'll notice here that it says that it separates the left lobe into medial and lateral segments, and that's true for the surgical lobes. But for the anatomical lobes, this is left and this is right. And then we're going to flip the liver over so that we're actually looking at the undersurface of it. So this is a visceral surface, and there you can see a much better drawing and definition of the bare area was connecting to the visceral surface. There's the IVC coming down, the gallbladder. This is the round ligament, and you can see here the round ligament is the old umbilical vein, and it separates the left lobe from the quadrate lobe. So here's a left lobe, and here's quadrate here. You can see quadrate lobe. And this is the porta hepatis, and we're going to talk a little bit more about this as we see some different views of the liver. And then this is the posterior view again. We've got the right lobe here, the left lobe here, the falciform ligament at the top, the ligamentum teres and the round ligament, the extension off there at the bottom, gallbladder. And we won't use this view too much here in this lecture, but that was already included, and it was just easier not to cut it away. So on an axial image of the body, whether it be CT or MRI, you have to be aware that the right and left lobes of the liver do not necessarily correlate with the right and the left sides of the body. So if you drew a line anterior to posterior on this patient, this would be the left side of the patient and the right side of the patient, but the left lobe of the liver actually sits on the right side of the patient. Sometimes they can extend over to the left side of the patient, but most of the left lobe is contained on the right side. So this is actually considered right and left lobes of the liver. So in considering right and left, don't worry about the sides of the patient on this particular, on these particular words that you use to describe it. So it's right and left lobes of the liver. This is an axial CT. You can see the bone here, so that's how you know it's CT. This is a little bit more through the mid part of the vertebral body than it was on some of the other images that we looked at. Once again, you've got ribs around the sides, air in the stomach, air in the colon, maybe a little cyst on the spleen here. And then you've got the right cruise of the diaphragm running up and around here, encircling the aorta, and you've got the left cruise of the diaphragm on this side. Probably coming into an adrenal here, right adrenal, sits on top of the kidney. And then we've got the aorta here, nice bright white contrast, you know, there's IV contrast, and the IVC, and the portal vein. Got the right lobe of the liver, nice large lobe of the liver, and the left lobe of the liver here. And an extension, a medial extension of the right lobe of the liver is this caudate lobe or caudate process right here. It sits in between the portal vein and the IVC. And this is not an exact same level. Obviously, this is not a real patient, so the drawing is a little ambiguous. But this is the portal vein here, and the IVC, and you can see the caudate lobe or the caudate process here. And we're going to talk about the surgical divisions of the liver in a little bit, but know that they divide up the liver into 8 different segments. And the left lobe of the liver actually has a medial and a lateral segment, and the medial segment is closer to the right lobe, and the lateral segment is further away from the left lobe. So this is medial segment, and this is lateral segment of the left lobe. Medial meaning closer to the right lobe, lateral meaning further away from the right lobe. So now looking a little bit more inferior, we're still in a CT image, and this is posterior, right, and anterior. And we're going to be looking at the quadrate lobe this time, and the quadrate lobe is a medial projection of the left lobe of the liver. And so you've got the lateral left lobe here and the medial left lobe here, and you've got the fissure for the ligamentum venosum here, and the portal vein, and the right lobe of the liver. And in between those 3 is a quadrate lobe here. And on this image over here, and this is from eAnatomy, and this is available to you through the library. And if you're not sure how to do that, it should be in the announcements section. I do not know, however, if the segments of the liver are color-coded now. It used to be that you could get the color sections up here, as you see, purple, green, yellow, orange. As you scroll through, you would be able to see the different segments. But the last time we tried to access that, it was unavailable, and we have put in requests to the library. I think now what I have seen is that the labels on the side are labeled in different colors so that you can kind of get that same idea, but it's not quite as nice as having the structures outlined here. So once again, we have the left lobe of the liver, surgical lobe of the liver, and the right lobe of the liver. And this is the left medial segment and the left lateral segment. And this little portion here of the left medial segment is a quadrate lobe. And then you have the right lobe of the liver, and the right lobe of the liver generally has anterior and posterior sections. And the posterior medial projection is the caudate lobe, and you can see that here, the caudate lobe, the posterior segment. Netter's plate 278 is great for viewing the vasculature of the liver. We often talk about the portal triad as these 3 vessels that go into the liver at the bottom. Actually, the common hepatic duct is coming out of the liver, draining the liver, and the portal vein and the hepatic artery are going into the liver and feeding the liver. But you will see various versions of this portal triad, little mini versions, all the way throughout the liver. So you're getting the liver fed and drained by these 3 vessels. And of course, the vessels get smaller and smaller the further out into the segments and sections that you go. Draining the liver at the top is the hepatic vein. And you'll see that you have veins coming from the left lobe of the liver and the right lobe of the liver. And then they'll go into the IVC. But the fact that you have these 4 vessels, the hepatic vein, the hepatic artery, portal vein, and common hepatic duct, feeding each section of the liver is one of the reasons why it is more easily surgically resected. So this is the surgical classification of the liver, and it's actually called the Kuhnad classification. And it divides the liver into 8 segments. And this image came from a website called the Radiology Assistant, and it has a lot of great images. I have a few more in the slides to come, and there are even more on the website that help you understand how the liver is divided, both from an anterior viewpoint here and then from an axial. And we did see one of the axial slices a little bit earlier on when I was showing you the caudate process. So the segment number 1 is the caudate process, and it's a caudate lobe, and you can't see it from the front so well, but they have opened up the liver here so you get a little bit better idea of how the vessels separate it, and then also so that you can kind of peek behind and see that caudate process. And here they just kind of show you that number 1 is hidden back behind there. And each one of these segments has a different branch of the hepatic system and can function on its own. That has the hepatic artery and the bile duct and drainage to the portal vein as well. And they do follow a somewhat clockwise pattern. So 1 is hidden behind here. 2 and 3 are the lateral lobes of the left segment of the liver. And they sometimes make this 4, like down here, or 4A and 4B. And this is the medial segment of the left lobe of the liver. And then segment 5 is the right anterior inferior portion of the right lobe of the liver. And section 6 is the anterior inferior portion of the right lobe of the liver. Or I'm sorry, the posterior, not the anterior, the posterior. And number 7 is the posterior superior portion of the right lobe of the liver. And then number 8 is the anterior superior portion of the right lobe of the liver. So you can see that the right hepatic artery divides the right lobe into anterior and posterior segments. So here, this is the anterior segments, and these are the posterior segments. This is the right hepatic artery. And the middle hepatic vein divides the liver into right and left lobes. So here, middle hepatic vein. And the falciform ligament divides the left lobe into medial and lateral segments. That would be here, falciform ligament. You can see the falciform ligament here. And the portal vein divides the liver into superior and inferior portions. So here, portal vein. And these are some nice axial slices of a human liver. And it's a CT scan. Got the white bone in the back and the IVC contrast. And you can see if you start at the top here, number 1, this is the most superior. And we've got the left lobe of the liver here and the right lobe of the liver here. So 2 and 4 are part of the left lobe of the liver. And then 7 and 8 are part of the right lobe of the liver. So remember that 7 was the superior posterior side and 8 was the superior anterior side. And then 4 and 2 over here on the left side of the liver were the medial and lateral segments. So same segments here, we're just a little bit lower. And same segments here. Got the left portal vein here dividing these two. The medial and the lateral segments of the liver. And then as you go just a little bit lower than that, then we're starting to get into the third segment here of the liver. So now we're getting a little bit more inferior on the left lobe of the liver, left lateral lobe of the liver. And here now we're also coming into the caudate lobe here. And then we go down a little bit further than that, and now we're getting into 6 and 5, which are the inferior segments of the right lobe of the liver. 6 is the inferior posterior, and 5 is the inferior anterior portion. And we got the falciform ligament here, dividing the left lateral and the left medial sections. And then down a little bit lower than that, we're almost out of the liver here, almost out of the left lobe of the liver, at least in the front. And there's a link here, and there are more images on this radiology assistant page, and also a video that has some axial MRI images, and they walk you through how the lobes can be divided, and it gives you just a little bit more information. So once again, these are more really nice images from the radiology assistant showing how they segment the liver and actually do resections, and how they name the resections. So if you're doing a right hepatectomy, you're going to take 5, 6, 7, and 8, all 4 lobes right here, 5, 6, 7, and 8. If you extend that into number 4 at all, or if you take all of number 4, then it's extended right hepatectomy. And they some of them like to say extended rather than trisectionectomy, because they don't want to necessarily consider the whole third section if they only take a portion of this right here. And then if they do a left hepatectomy, it's 2, 3, and 4, and a left extended includes the right portion of the liver here, the number 5 and number 8. So that's the superior anterior and the inferior anterior sections of the right lobe of the liver. And then they can just do the right posterior sectionectomy and the right anterior sectionectomy, left medial and left lateral, so they can take out just those segments. It appears they don't do any just inferior or superior portions of the liver. It's always a superior and inferior portion together. So this last image I want to show you is an image that I found on an RSNA educational exhibit. Somebody had created this lecture for that, and it's interesting to see how they determine how they're going to do surgery in the liver. You can see some of the vessels here, and this is the left hepatic vein and the right middle hepatic vein. And they're talking about doing a resection of this area here, so they want to secure the middle hepatic vein and clamp off the left hepatic vein so that they can do the surgery. And then this is the vena cava here. So they're trying to determine exactly how the blood flow works to the vena cava and what they're going to affect if they clamp off this area. And so that's the things that they need to check before they do surgery. So I thought this was a great image, and it gives you a real life image of what's going on there when they do the preoperative scans. And so this is a multiplanar reconstruction image from a CAT scan. And that's the liver and the biliary system. And we will move on to the next lecture.